Hello and welcome to yet another edition of Africa Speaks. We are broadcasting live from Kenya, and our online stream is ktnkenya.tv in case you want to stream us online. And Ebola remains the biggest issue in Africa today. The World Health Organization has warned that the current Ebola outbreak is spreading unusually fast and that it would take months to fight it. This even as the serum ZMAPP manufacturer reveals that they have run out of the drug. KTN's Wilkis Tanyabwa reports on efforts Africa is making to fight the Ebola outbreak.
Weeks ago, nobody save for authorized medical practitioners would have dared to venture anywhere near Kent Bruntley, the missionary doctor diagnosed with Ebola. Thursday, however, was a new day, one in which he emerged triumphant and apparently Ebola-free. Brunt is one of 2 Ebola patients discharged from the Emory University Hospital in Atlanta this week.
Dr. Brantley has recovered from the Ebola virus infection and that he can return to his family, to his community, and to his life without public health concerns.
I'm thrilled to be alive, to be well, and to be reunited with my family.
33-year-old Bruntley and 59-year-old Nancy Wright-Ball, both American missionaries, were infected with Ebola while working together in Liberia. They were airlifted to the United States for treatment. According to reports, Bruntley's condition deteriorated so quickly that doctors decided to give him an experimental drug in a last-ditch effort to save him. He and his colleague Nancy were the first people with Ebola to be treated in the United States. They were also the first humans to receive the experimental Ebola drug called ZMAPP. Both are no longer a health threat. While the discovery of ZMAPP is seen as a breakthrough, Dr. George Nakitare, the acting director for virus resistance, warns that the recovery of the 2 cannot be attributed to the drug just yet.
Those kind of studies must be expanded to include humans, what they call the clinical trials, where some group of people are given the drug or the preparation and another one given the placebo, so that they see comparisons whether it's actually the drug that is working or some other factors.
ZMAPP has also been given to 3 healthcare workers in Liberia who have shown a marked improvement, but about half of the Ebola patients in the outbreak are surviving without the experimental drug. Marvin Kai, an orthopedic assistant who contracted Ebola while treating a patient in Liberia, left hospital after making a full recovery on Thursday. Church members welcomed him home with worship songs, declaring his recovery a miracle. This while a Spanish priest who received ZMAPP later died. As the debate about the effectiveness of the drug rages, the drug's manufacturer, MAPP Biopharmaceutical of San Diego, has said there is no more of the drug left. Public health officials now say, potential cures aside, Ebola can be stopped by ensuring it spreads no further. Wilkis Tanyabwa, KTN.
Now, even despite the United Nations saying countries across the world restricting travelers from West Africa was unjustified, a number of countries in Africa have cancelled flights to Liberia, Sierra Leone, and Guinea-Conakry. In fact, Cameroon cancelled Nigerian artist Davido's concert due to the Ebola fear. But should African nations restrict travel, and should airlines deny West Africans entry into other parts of the continent? Jeff Okoroafo, who is the founder of Opinion Nigeria, shares his views right here.
First, I want to say that it's not a question of closing the border that secures the citizens of Kenya, but it is a question of how secure are they, even whether or not the border is closed. There's a lot of economic implication of shutting out your border from every other country. The big point here should be, what is the African Union doing about the issue of Ebola virus? African Union should come up, they should stand up to take charge of the issue, because it's an African issue right now. The African Union should stand up and take care of the Ebola outbreak in Africa. Let them come up with a more robust measure that can curtail the virus, and also, this is very much important, and also try to share information between the African countries. Now, if every country in Africa understands what is happening in other countries, they will be able to know when the virus is much, and what region is coming out from, and what measure those countries are taking to contain the virus. As whether or not Nigeria is containing the virus, yes, Nigeria it is. I mean, surprisingly, this is the first time that Nigeria is standing up to the demand of the people. Nigeria government has done quite a lot in trying to contain the virus in Lagos, where the outbreak first came in. There has been a lot of screening mechanism put in place in our airports and on the road, and also in our hospitals. There has been an isolation center, and I know very much that some of us who are listening and watching us right now have gone through some other sources, and they know what the United States Health Center for Disease and Prevention said about the Nigerian effort in trying to control the Ebola virus. And also the World Health Organization has given Nigeria a thumbs up. So we are trying very much to contain the virus, the Ebola virus. And so I think every other countries in Africa should not be worried whether or not Nigeria is trying to circulate in every other part of the country. No, we are not, because a lot of people, and the good thing is there's a cure for this virus now. We have seen it in Nigeria, we have seen it in Liberia, where the ZMAPP drug has been given out, and there has been a success story. So Ebola is not airborne; it is something that is curable, and I don't think people should be so scared about it. I think what the Kenyan government should do is find a way to educate their people on what causes Ebola and how to stay clear from contaminated, from infected people. If the Kenyan government carry out this measure and also prepare beforehand, it will go a long way than shutting out their border. Because, for instance, let's say if the Ebola virus lasts for decades, will they be able to still shut down their border? So it's a measure that is not going to work very well for the Kenyan government. So I think what every country in Africa, the 54 states in Africa, should do is try to hold on to the African Union, compel African Union to come up to the demand, and then take charge of this Ebola issue. Let there be a cross-pollination of information from every part of the African nation. And in so doing, I believe personally that the issue of Ebola will not be a thing that the African people have to be worried about. Thank you very much for listening.
At Rosalina Rose says the Ebola outbreak shows us that iniquity, inequality, and injustice are powerful determinants of health. At Emmanuel Igunza says months after the Ebola outbreak, African Union announces a $25 million plan to send special team to 4 affected countries. At Aku Obadu or at Golden Dove adds eventually the African Union has woken up from its slumber 6 months after the Ebola outbreak. And finally, at Jared Jordan sarcastically wonders out loud on why there isn't an ice bucket challenge for the Ebola outbreak.